the issue is, of course we want to get it into care homes to protect the most vulnerable as fast as we possibly can. The Joint Committee on Vaccination and Immunisation has rightly said that care home residents must be a priority. The difficulty is in distributing the cases to care homes. Each case has 975 vaccines in it, and obviously you want to avoid wastage, and the difficulty is that the MHRA has not yet authorised the people who would be transporting the vaccine to the care homes to be able to effect the division themselves. I know it sounds complicated, Emily, but that's because this vaccine, and JVT also, Jonathan may want to come back on this, this vaccine is, it needs to be kept deep frozen, as you know, minus 75. There is a risk that if it is allowed to degenerate by being improperly handled, it simply won't work. So the rules around the transport of this vaccine are extremely important. And to get to your point about speeding this up and making sure we get it into care homes as soon as possible, we're expecting to hear more soon from the MHRA about how that can happen. But I think it would be fair to say that we certainly want to be putting it into the groups that Simon talked about just now: care home residents, care workers, NHS, and above all, those above 80 who are the most vulnerable. Our objective must be to use the vaccine stocks that we have to protect those who are most likely not just to fall ill, but to succumb to the disease. That's what the JCVI has decided, and I think quite rightly. But Jonathan and Simon.
If I may come in, Prime Minister, and say, Emily, I think your remarks about failure are extremely unfair when one considers that a new virus emerged less than 12 months ago and we already have our first vaccine. And Professor Stevens has been very clear that as soon as it is legally and technically possible to get the vaccine into care homes, we will do so. But, you know, this is a complex product with a very fragile cold chain. It's not a yogurt that can be taken out of the fridge and put back in multiple times. It's really tricky to handle. And so I think, you know, we'll get there as fast as we can is the answer, and we are trying extremely hard.
So anything you want to add on that?
Well, no, I think you've both said it absolutely accurately. I mean, we are raring to go in the NHS. We want to be able to vaccinate people in care homes for COVID, just as we vaccinate care home residents for many other things, including winter flu. Just as soon as we have the regulatory sign-off that we can do that, we can get the jabs to the care homes so that the GPs and the nurses can then arrive and give those care home residents that COVID vaccination, we will do that. And we, at this point, with a fair wind, fully expect that that will be in the first tranche of priorities for vaccination during this month.